Well, whether you switched to a new health plan during the open enrollment season last year, or you opted to stick with the plan that you had, for most Americans, the beginning part of the new year means new benefits, and it's also a great time to better understand your coverage to help you get the most out of your plan throughout the year, improve your health, and perhaps even save money for next year. Joining us today is Dr.Milich, CEO of United Healthcare Texas, Oklahoma, to offer suggestions on how you can get the most out of your healthcare benefits for this year. Take a look.
Your employee benefits, insurance in general, can be very confusing. You know, we have almost our own vocabulary that we use. And so, really individuals getting to understand just basic terms. What's a copay? What's coinsurance? What's a deductible? What does out-of-pocket maximum really mean in layman's terms? And there's a website called justplainclear.com where folks can go to better understand what are common healthcare and health insurance terms, and really helps people to better understand and get the most out of their employee benefit plan that they have made available to them through their employer, or even if they're buying insurance on their own. Telehealth or virtual medicine is something that during the pandemic has really grown in terms of utilization. Some health professionals are seeing 50 to over 150 more patients visits through a virtual type of environment. The reality is, especially during the pandemic, a lot of us were at home. We were working at home. Our kids were home from school. And so that ability to be able to see not only a physician, but your family physician, your normal family physician via telehealth or virtually, was really important, especially for individuals who have a chronic disease and didn't feel comfortable going into their physician's office. Also, too, it's a great way to save money. Most benefit plans offer those virtual interactions at a lower copay and certainly at a lower cost than maybe what you might experience if you were doing an in-person visit. Again, I would tell you, everybody needs to check their benefit plan to see what are made to them. We have programs. One is an emotional support app called Senvelo. We also have something called Able To, that's an 8-week virtual therapy program that's really designed to help people with eating disorders. But there are many behavioral health opportunities. I would tell you that back to virtual health, one of the big types of service that we saw during the pandemic in terms of virtual health and why people were utilizing it was to be able to interact with a behavioral health professional. So again, a lot of opportunities to use technology to be able to engage when maybe we can't get out and go see somebody face to face.
Well, there you have it, the different ways that you can make the most out of your health plan and get the most out of your benefits for this year. For more information on how the team at United Healthcare can help you, then feel free to visit UH.com.